Jai Swaminarayan, and a very warm welcome to this evening's BAPS Wellness webinar titled Women's Wellness, Understanding Your Cycle, Hormones and PCOS. We're delighted to have you join us. My name is Sapna, and with me today is Tanvi Ben. We're both GPs and also volunteers on the BAPS healthcare team. Tonight's session is part of the BAPS Wellness Initiative, which is all about promoting lifelong health through nutrition, exercise, sleep and stress. This holistic approach is inspired by the values of our gurus, Pramukh Swami Maharaj and Mahant Swami Maharaj, whose teaching reminds us to care for both body and spirit. Today, we're going to be focusing on an area which is often overlooked, women's health. So women's bodies are unique. Hormones shift not only across a lifetime, nor every month. They're changing all the time, every day. These changes affect everything from mood and energy to skin, weight, fertility, and sleep. And yet many women silently endure symptoms like painful periods, heavy periods, or fatigue, thinking it's just part of being a woman. Too often, problems related to periods go undiagnosed.
In our community, sometimes it can be really difficult to openly talk about menstrual health, but the silence comes at a cost. That's why today we're opening the conversation, honestly, respectfully, and with compassion. For the men watching, please do stay. We hope it will help you better understand the women around you and therefore be able to support them. And to help us open up this conversation, we would like to introduce Dr. Ravina Bhanot. She's an NHS Women's Health GP and specialises in contraception, menopause and fertility. She's the founder of a fertility education platform called Zonus Fertility, and she's a media doctor for the BBC, Channel 4, and on her social media channel at dr.ravina. We'll post that in the chat. She's really passionate about educating on all things women's health, and so we're really lucky to have her. There will be an opportunity to ask questions after the talk, so feel free to type them in the chat as we go along, and we'll do our best to answer them afterwards. Over to you, Ravina.
Namaste. Jai Swaminarayan, thank you so much for having me and inviting me to talk on this really important topic, which is women's health. And you're so right, it is a huge taboo topic, and these issues are affecting so many of us. And what we're finding in the South Asian community is that many of us women are staying quiet about it, and it's leading to problems. It's leading to us not being diagnosed about things. It's leading us to be suffering for so long. So today what we wanted to do was talk through some really important women's health issues that many of us are dealing with every single day. So what we will cover is, what is a normal menstrual cycle? What is an abnormal menstrual cycle? So you know what the difference is. The key red flags, so when to go and see your doctor, when something might be wrong and abnormal, and when you should get help. We'll also cover some really common issues like polycystic ovarian syndrome, which we find is so much more common in Indian women than any other ethnicity. We'll talk through when to see your doctor, the red flags. Then we'll go on to endometriosis. This is also really common, and we'll also talk through the red flags with that as well. Okay, so what is a normal menstrual cycle? You may know that you have a period every month, but actually what's happening to our bodies is changing throughout the month and not during just that time when you're bleeding. The menstrual cycle is a hormonal change that happens in our body to prepare a woman's body for a possible pregnancy. But of course, most of the months this doesn't happen, and our body has to deal with all these fluctuations, these things changing in our body every single day. The normal length is about 21 to 35 days. On average, it's about 28 days, but we give and take a few days. So if you feel that your periods are not exactly 28 days, that's okay, that's normal. Day one is the first day of bleeding. So that's what we count as day one. And your period, so the time that you're bleeding, may last anything between 2 days and 7 days. And we know there's scope for change with that. You may also notice some symptoms with your period. So you may notice you feel really tired, you may feel really moody, you may feel sad, you might feel that your mental health's really different in that time of the month than any other time. You might find that you've got really bad tummy ache to the extent where it's affecting your everyday life, and that wouldn't be normal. And then also changes in other parts of your body, like your breasts, and you might feel a bit of pain and tenderness. And if that gets quite severe, then that's something that wouldn't be normal. So these things are some of the normal things. So let's move on to what your menstrual cycle looks like throughout the month. So just looking at this diagram, I'll break it down for you. So we're starting at day 1, and you can see the first 5 days is the bleed, on average 5 days. After that, you have the follicular phase. So there's 4 phases in your menstrual cycle. So the second phase is the follicular phase. Now, this is time in your cycle where you will actually have the most energy. You'll feel happiest, you'll feel like you want to talk to people, you want to socialize, you want to go out, you feel the most attractive in yourself. And the reason for that is because your estrogen, which is a good hormone that we like, makes you feel more confident in yourself. And that builds up slowly over day 6 to 12, up until ovulation. And ovulation is when your egg is released from your ovaries. And that means that you're able to get pregnant. And that's when your estrogen's high. So you'll have lots of energy in that part of your phase of your cycle. And then after day 15, you have a luteal phase. And luteal phase is notoriously known, so thought to be the worst part of your cycle. And it's been given a bad reputation. But actually, the luteal phase is a time when many women may feel really sad. You'll notice that you've got a change in your mental health. You'll feel like you want to eat everything. You're going to have food cravings. You might have some really severe tummy pain. And it's a time when we usually recommend that even though you don't feel like doing anything, it's the time to make sure that you've got good nutrition, you're eating really well, and you're also exercising. So it's the thing you least want to do, but it's the most important thing to do. So let's talk a little bit about what is an abnormal period. So cycles less than 21 days are a little bit short. So we'd want to investigate that. And if they're over 35 days, so that's the first day of the first bleed and the next month, the first day of the next bleed, that's what we're counting as a complete cycle. So if you're finding actually yours is more than 35 days, you need to talk to your doctor about it. Very heavy bleeding. So I see lots of patients, they say, oh no, my periods are normal. I go through about 10 pads a day. That sounds like too much to me. So you need to just monitor how many pads or tampons or whatever you use, you're going through every day. Monitoring it is key because your doctor will ask these questions. So make sure you're tracking how heavy you're bleeding, what days of the month are you bleeding the most. So soaking a pad every 1 to 2 hours would be considered as a heavy bleed. And then prolonged bleeding. So if you're bleeding for more than 7 days of the month, that's also a little bit too long. So even if it's just spotting every day, 7 days may be a little bit too long. If you are bleeding quite a lot, there is a risk that you will have anemia. And some of the signs of anemia are feeling really tired, feeling a little bit dizzy, feeling like you can't breathe, feeling quite short of breath if you go up the stairs, or if you go for a brisk walk and you're feeling very short of breath, we'd probably want to do a blood test for you if that's the case. Painful periods that are affecting your daily life. So if you've got to a point where you're on your period and it's so painful that you can't go to work, you can't do your daily activity, you can't exercise, you can't study, you can't look after your mother, your grandmother, whoever you're looking after, that is not normal. If it's affecting your daily life, then there may be something more sinister that we need to do some investigations for. Bleeding in between your periods. So this is bleeding outside of your 5 or 7 day period that you have every month. Bleeding after intimacy with your partner. So this is actually something that many women will never talk about. They've never spoken about. They'll just keep it to themselves. But if you experience any bleeding after any intimacy, we really need to know about it because we might need to examine you. And then finally, not having any periods at all. So if you've had maybe 6 months without a period or 3 months without a period, that's not normal. And we would want to do some blood tests. We may want to do a scan for you. So it comes down to the importance of tracking your periods and keeping an eye on when was your last period and when was the period before that. Okay, so we're now going to come on to polycystic ovarian syndrome. And this is such a common condition that so many women will suffer from. So it's one of the most common hormonal disorders in women, and it affects your ovulation. So that affects your release of an egg from the womb, and it will lead to having irregular periods. So you may have one period every 2 months or one period every 3 months. It affects 1 in 10 women worldwide, which is very, very common. But with South Asian women, it's affecting 3 in 10. And that is a very high statistic. We're finding that it affects a lot of South Asian women, but women aren't coming forward with the symptoms. So they're not getting help, they're not getting a diagnosis, and they are suffering. They're suffering for many years before they actually understand that they've got something wrong with their ovulation. So if I just show you this diagram, so this is a womb. So this is where your baby will grow. This is coming down out into the vagina. These are your tubes. So these are tubes that are connected to your womb. This is a normal ovary. So you can see it looks quite normal. Whereas this side, it's polycystic. So it's quite bulky, it's quite big. You can see there's lots of cysts attached to the ovary. And that's quite commonly seen in polycystic ovarian syndrome when you get a scan done. But there are cases where your scan might be normal, but you still have polycystic ovarian syndrome. So what are the key signs of PCOS? The first is irregular periods. So if you can't really gauge what day you're going to start, or you get caught off guard quite often because you don't know that your period's about to start, that's usually because it's irregular. A missed period is where you had one period last month, but you've perhaps missed it this month and you can't really track it on a monthly basis. Excessive hair growth. So what I find with many Indian girls is they say, look, I'm Indian, so I've always been hairy and my family are hairy, my mum's hairy. So it's normal, isn't it? It's normal for me. And actually, no, it's not always the case. We can't always blame our genetics. There are also hormonal changes that happen that mean that we have more hair growth in certain places in our body. So one being the face, so specifically around your jawline. The second is your chest, so the upper part of your chest. The back, all the way down the back, and also the stomach. So if you experience excessive hair growth in these areas, it's something we'd want to look into a little bit more. The next is acne. So acne or oily skin. As you grow up in your teenage years, you may have a lot of acne, and that's quite normal. Teenage hormonal acne is very common. But this is acne that goes past that. So even in your adulthood, you're getting acne. That is not normal. Scalp hair thinning. So a lot of people lose hair, but how do we know it's related to your hormones or not? Well, if you get sort of crown hair thinning, so right at the front, similar to a male pattern baldness where men usually lose hair, that is what we consider as more of a hormonal related hair thinning. And then also weight gain. So if I show you some pictures, so here you can see there's quite a lot of cystic acne. So this looks like quite angry red acne on the face. And here we can see some excessive hair around the jawline. That's very typical of a hormonal issue. And here is hair loss around the top of the head, around the crown. And that's also a sign, can be a sign of PCOS. So what can I do about it? What can you actually do about it? So if you are worried, you can speak to your doctor, of course. and they may give you different treatment options. But for today's talk, I wanted to focus on what you can do to empower yourself with knowledge on changes that you can make in your everyday life that can help to not only help your symptoms, but also reduce the sign of the disease. So the first thing you can do is lose weight. So around 5 to 10% of body weight will actually improve or even resolve your symptoms. And how can you do that? I'm not talking about weight loss injections, because actually you can do a lot of it on your own. You can do a lot of it through your nutrition. So low glycemic index carbohydrates include swapping white bread, white rice to brown rice, brown pasta, brown bread. And these are one of the smallest, easiest things you can do that will help with reducing your PCOS symptoms. Oats are great to have in the morning. They contain a lot of fiber, and they're really good at keeping you full and controlling some of your weight gain symptoms that you can get in polycystic ovarian syndrome. And then anti-inflammatory foods. So omega-3 is a really good nutrition supplement that you can take either from food, or you can get it from a supplement. From food, you can get it from seeds, you can get it from nuts. And the reason why it's really good is because it helps to calm down the symptoms that are going on in your womb, because it acts as an anti-inflammatory, so it reduces the inflammation. And the easiest way that you can incorporate this is put it into your cereal in the morning, or put it into your oats in the morning. And that's one of the easiest ways to make sure you get your daily requirement and you do it regularly. The next thing is berries. So things like strawberries, blueberries, blackberries. These are really easy. Throw them into your breakfast, throw them into your dessert after dinner, and they contain antioxidants. And then spices, so turmeric, cinnamon, ginger, there's lots of evidence to show that this can help your symptoms too. Now, the next thing I'm going to talk about is increasing your protein. And the reason why it's really important to talk about your protein, especially in a vegetarian diet, is because so many of us do not get the recommended amount of protein we should do as women. Men always talk about protein because they're always into building loads of muscle and being ripped or getting a six-pack. But actually for women, it's really important that we are increasing our protein, because it helps to support our bones and our muscles and helps to reduce any hormonal change that can happen. So the easiest ways to do that are, I hope everyone's eaten their dinner, because I might make you hungry with all these pictures. The first is tofu. Tofu is great because it contains lots of protein and not too much fat, whereas paneer does have protein, but if you have it every day, you're having a high amount of fat, and we want to reduce that, especially if you've got a high risk of high cholesterol in your family. Greek yogurt. Greek yogurt's really good. So whether you have that for breakfast, you have it with your dinner, whether you have it after dinner, just make sure it doesn't have any added sugar. Dal, rajma, chickpeas, these are really easy things that you should have almost on a daily basis. Have one of them, and that gives you a good amount of protein every day. So let's just go through an example of what you can eat in a typical day for increasing your fiber, increasing your protein. So for breakfast, you could have oats with flax seeds and berries. If you want, you can add a protein powder if you feel like you want to increase your protein. In terms of lunch, you can have brown rice, you can have dal, you can have mixed vegetables, have a salad. Some people just prefer to have a salad, and that's absolutely fine. Just make sure there's a little bit of protein in it. Snack, so have a Greek yogurt or berries or chia seeds or hummus, something that's nutritious and filling. And then dinner, you can have like quinoa khichdi with vegetables, a raita, something that's wholesome, well-rounded meal. And if you have that, something along those lines, you will most likely hit your nutritional protein amount per day. And the amount that's required will depend on your weight. It's usually around 1 to 2 grams per kilogram. So if you're about 65 kilograms, then we're aiming for around 100 grams, a bit more if you can, per day. Okay, exercise. So it's really important that we don't forget to look after our body, and moving our body every day is really important. So strength training twice a week is Absolutely important for anyone with polycystic ovarian syndrome, a hormonal imbalance, painful periods, even sort of end of the spectrum if you're sort of going through perimenopause or menopause. And the reason why I think strength training is so important is because we are, as South Asians, our genetics favor us having weaker bones and weaker muscles. So we need to do everything we can to fight those genetics and build our muscle through body weight. So if you don't want to use strength sort of weights, to actual weights, you can just use your body weight by doing squats at home or push-ups. You can also use dumbbells, resistant bands, and you can just get them from Amazon. You don't need to pay for a gym membership necessarily. And strength classes if you feel that you want a bit more support. And then I also think yoga and Pilates is really good with period pain, mood, and sleep. So I typically try and do Pilates during my luteal phase, so maybe the week or two before my period, because my mood is a bit low, I'm feeling not my best, I feel really lethargic. So I try and force myself to do some activity, and that is Pilates. So when should you see your doctor? So these are some of the key symptoms that you should be aware of. And they're red flags, and this is when you should go see your doctor. So the first is if you're having irregular periods. The two is if you've got excessive hair or acne or sweat. The third is if you're feeling very fatigued. The fourth is if you're trying to lose weight, but you're finding it very difficult, and no matter what you're doing, it's not helping. And lastly is very heavy periods. So I'm going to now move on to endometriosis. Endometriosis is really common and not very widely spoken about, but I will just talk you through what it is. So it's a condition where you have tissue that is usually found in the lining of the womb, but it grows outside of the womb. So commonly in the ovaries, in the fallopian tubes, in the bladder, in the bowel, and it affects 1 in 10 women. But the problem is, if you're an Indian woman, you're 60% more likely than a white woman to get endometriosis. And this can start from a teenager right up until menopause. So the problem is we're not getting diagnosed quick enough. So women are suffering with many, many symptoms because they are not aware necessarily of the symptoms, so don't get help soon enough. If I just direct your attention to this diagram, on the left side, you can see this is a normal womb. So this is the womb here, these are the tubes, this is the ovary. Now on this side, you can see there's little deposits of the endometrial tissue, and this is a sign of endometriosis. It shouldn't be there because it should really just be on the inside lining, and that's something we usually see in a procedure. You can't always see it on a scan. Okay, so what are the signs? What are the signs? So the first is really painful periods, and you might actually get a painful abdomen even when you're not on your period, and that's really common in endometriosis. Pain during intimacy. So if you're getting any pain, as I said before, it is not normal. Chronic pelvic pain. So what that means is you're getting pain throughout the month, not just on your period, and you're getting it sort of on the lower part of your abdomen, so lower down. You may also get pain with a bowel movement or when you pass urine. Typically when you are on your period, that's a really key sign of endometriosis. Fatigue. So you might feel tired all the time and you're taking your supplements, you've got a good diet, you're exercising, but you're still feeling fatigued all the time. Having issues getting pregnant is a really common question. A lot of patients ask, oh, if I've got endometriosis, will I be able to get pregnant? The answer is yes, you can, but sometimes it does take a little bit longer. So if you've been trying for quite some time, if you're over 35 and you've been trying for about 6 months, I recommend you speak to a doctor and get some help. If you're less than 35 and you've been trying for about 12 months, I recommend you talk to your doctor. So it takes on average 7 to 10 years for Indian women to get diagnosed with endometriosis, which is a huge amount of time to be going through these really horrible symptoms. So if you feel that you hit any of these symptoms or you experience any of them, it's really important to speak to your doctor sooner. So let's go through some practical tips on if you think you have endometriosis or maybe you've already been diagnosed with endometriosis, what can you do to help from your nutrition side of things? So the first thing is you want to swap your white rice for brown rice. You want to include a bit more protein, so maybe Greek yogurt, something that you can add to your breakfast or have with your dinner. In your vegetable curry, add a bit more. So just pack it with lots of really good vegetables. Pack it with loads of good spinach and make it as nutrient packed as you can. Healthy fats. I love avocados. I think they're really tasty, they're really filling, and they've got good fats in them. So if you like avocados, definitely try them as a regular. Nuts are also a great snack, and we also mentioned like flax seeds and chia seeds that you can add to chutneys. And also inflammatory foods. So with endometriosis, there's lots of inflammation and we want to reduce the inflammation. And what research has shown is that if you swap fried food, so fried samosas, and air fry them instead or grill them instead, it reduces the amount of oil. It makes it less inflammatory for your body. So overall it's better to not fry. And also too much sugar. It's really hard because you don't always know how much sugar is in things. And I'll give an example of that. As you can see, there's some delicious mangoes here, and everyone loves mangoes because it's mango season. But what we don't realize is the reason everyone loves them is because they're full of loads of sugar. And yes, they are a fruit, but fruit can also not be too good for us if we have too much of it. So one mango might contain about 45 grams of sugar, and the recommended amount is about 30 grams of sugar a day. So with one mango, you've probably already exceeded your sugar per day. It's not a bad thing in moderation, but if you're having a mango every single day or having something sugary every single day, it's not good for you. So just a small amount in moderation. Okay, so now I want to just touch briefly on stress and anxiety, because we know our overall environment, how we are feeling within us, how our lifestyle impacts our everyday, has a huge impact on our emotional health and also our women's health. So how can we manage it? How can we manage stress and anxiety, and how can we use it to improve our symptoms of painful periods and heavy periods? The first thing is breath work. So I like to teach my patients how to do the 4-4-4 technique. So this is when you take a deep breath in for 4, you hold it for 4, and you release for 4. So we can actually all do it together. You can do it from home. So we are going to take a deep breath in. So 1, 2, 3, 4, hold, 2, 3, 4, and release 2, 3, 4. And if you do that about 10 times a day in the morning before you go to sleep, if you're in a stressful situation, it can really just help to bring down those stress hormones and just calm everything down. My patients really like journaling. They find just getting any negative thoughts out of the mind and onto a piece of paper can help to calm the brain and calm the stress hormones. Meditation has got lots of research for it. CBT, so this is cognitive behavioural therapy, which is a type of mental health support, which your doctor can assist you with if it's something you feel you need a bit more help with. And of course, there's lots of apps like Headspace, which is really good with mental health support. Okay, so just to finish off, I wanted to stress 2 or 3 things. The first thing is lifestyle can help to manage your symptoms so much. So things like heavy, painful periods can actually sometimes do more than medication can. So it's really important we focus on what we can do in our everyday life to help support our symptoms. Next is increasing your protein. So I'd say at least 100 grams per day if you can, and strength training to help to reduce your PMS symptoms and your polycystic ovarian symptoms as well. And then finally, if you do experience any of the red flag symptoms that we've discussed, then it's really important you speak to your doctor. And don't wait, don't think, oh, you know what, I'm fine, I've been fine for years, I will be fine. That's the problem. And if you're worried about even one small thing, it's really important you just talk to your doctor, because that one thing might lead to another thing, which leads to another thing. So don't ignore anything. And I'm not just talking to women, I'm also talking to men. Men, you have partners, wives, daughters, sisters, mothers, grandmothers that may have experienced any of these symptoms. And it's really important that we get men to help women advocate for themselves, so that the attention is brought to these red flag symptoms and we are helping our women to get better. So I know we've got quite a few questions that have come through, so I want to leave some time for us to answer them. I'm really happy for you to contact me on Instagram. I do lots of women's health education for all those embarrassing questions that you're too embarrassed to ask. I don't do any personal medical advice, but I'm happy to always give general advice. So I'll stop sharing and I'm happy to go to questions.
Thank you so much, Dr. Ravina. That was so interesting. And I mean, now we all know what is a normal period and when we should be asking for help. And I think there's a lot of information out there about kind of the medical treatments, but this was really enlightening in terms of lifestyle, how we can help ourselves. And also, I think the tips that you've given us are just generally good practice in our life, because it will be helpful. It will give us a balanced diet and help us mentally as well with our well-being. So we're going to start off with the rapid fire round, if you're ready.
Okay, yes.
And the first question is it normal not to have a period every month?
And it's not normal. If you're not having a period for 3 months in a row, then you have to talk to your doctor. If it's just been 1 month, we usually give it a bit of time, because things like exercise and medication can affect it. Also do a pregnancy test. That's one of the #1 reasons why you might not have a period, but we usually give it 3 months. So if you haven't had a period for 3 months, it's not normal.
Next question. Is it normal to have severe pain during a period?
No. Now, we usually need to investigate it first. Sometimes all the blood tests and scans are normal, and it may be that you have more sensitivity to pain. However, generally, severe pain during a period, no, is not normal.
And how about heavy periods? Are they something that we just have to live with?
No. So heavy periods, there's lots of causes. There's about 10 causes of heavy periods, like thyroid issues, PCOS, endometriosis, fibroids, lots of different reasons why you might have a heavy period. So once we do all the blood tests, we then decide, actually, is it to do with bloods or is it something else? But some women, even when everything's normal, will still have heavy periods because perhaps their mum had heavy periods and their grandma had heavy periods, and there is a sort of a genetic link to having it, and we don't always know the reason why.
And what about infertility? A lot of people are worried about that. Do heavy periods necessarily mean you're infertile?
No, not at all. The #1 thing is, if you're having a regular period, then you should be fertile because you're ovulating regularly.
And in terms of PCOS or endometriosis, can they affect fertility?
They can affect fertility, and that's why I think it's really important to speak to a doctor sooner rather than just waiting until you're ready to have children to talk to them. The reason why is because if you have PCOS or endometriosis, it can mean that it takes you 12 or 18 months rather than 6 months to get pregnant. So the sooner we know about it, the more we can do for it.
And you mentioned how stress and anxiety can impact our hormones and our periods, but can PCOS or endometriosis affect mental health?
Yeah, we know there is a mind-body connection with a lot of these mental health conditions. And naturally, if you're having heavy periods, if you're having painful periods, it's going to affect your mental health. So we know that we need to look after our women that are going through this, because it's not just a body issue, it's a mental health issue, and it's affecting everything, every system in the body.
And can endometriosis be cured?
Can it be cured? So endometriosis is an inflammatory condition, so it means you always have that process going on in your body. So we can't fully cure it, but we can help to manage the symptoms and treat the symptoms and treat the issues. Like if it's fertility issues, we can treat that, but we can't fully cure it, but we can help to improve the quality of life of women.
And when I'm on my period and I'm in lots of pain, paracetamol or ibuprofen, which one should I reach for?
So it depends if you've got any sort of underlying conditions like asthma, or if you're allergic to anything. If that is the case, then if you've got asthma, avoid ibuprofen. I would usually recommend ibuprofen for 2 reasons. One, because it is a great pain relief. Some women find it better than paracetamol, and you can get a fast-acting ibuprofen that works quicker than the normal one. And the second reason why I like ibuprofen is because it basically squeezes your womb to stop it from contracting. So you get reduced cramping, and it reduces how much blood comes out. So you get less blood flow and reduced pain.
That's helpful, thank you.
Thank you. That's the end of the rapid fire. Now we're just going to go to some questions that we've had posted on the chat. So the first one is, as many Indian women suffer from low iron, and because of vegetarian diets, how can one address the compounding impact of heavy periods?
Yes, I see this every single day, and it's always Indian women. So iron is such an issue because if you don't replace it, you will start feeling the symptoms of it. And if you're continually losing blood every single month with a heavy period, then you just need to make sure you're replacing it enough. So iron, absolutely. And usually we recommend taking it for 3 months, and then we repeat your blood test to make sure your iron's coming up, and not just your iron, but also the storage of iron in your body. I would recommend you take it sort of long term if you're continually having low iron. In terms of diet and vegetarian diet, you need to make sure, so there's different types of iron. There's some iron you can get from like a lot of meat, like red meat, but for vegetarians, we need to get more from vegetables like spinach and broccoli, and we need to have a well-balanced diet. So you need to make sure you're getting enough, but you're not forgetting to take the supplement on top. And it's a really common issue that a lot of women face, and you get a lot of symptoms from it, but it's about doing both and not letting it slide. You have to always take your iron.
Another question from the chat. My period flow has decreased in the last few months. Is this a sign of premenopause?
So it will depend on your age. So we do know that perimenopause, average age in the UK is 51, but some women will start getting symptoms 10 years before, so around 40. If the number one thing to change around perimenopause time is your periods, and we find that you become either heavy or lighter, and you become irregular. So they'll either come more often or less often. That's the number one thing to change when you're going through menopause. You may also get things like hot flushes and difficulty sleeping or brain fog. That's another sign of menopause. Decreased flow over a few months, not necessarily. There's lots of things that can affect that, like stress, exercise, change in diet, if you're on new medications. So I would have a look for just keep an eye out for the other signs of menopause, because that can indicate whether it is related to it or not.
Thank you. And I know from your slide, you mentioned that it's really important to go to your GP if you're experiencing bleeding after intimacy. What is the significance of that? What could that mean?
So what was that, bleeding after intimacy?
Yes.
Yes. Okay. So there's a few things that your doctor will want to do. The first thing is actually just have a look at your cervix. So your cervix is the part just at the end of your vaginal canal. So we need to look at anything abnormal on it. So things like polyps. So polyps are like growths on your cervix, and if it is there, we might want to remove it. It can be a sign, not to worry anyone, but it's always good to be aware. It can be a sign of cervical cancer, but if you're up to date with your smear tests, then it's less likely. You can also get, it also can be a sign of endometriosis, which is what we mentioned. Generally, we need to investigate it doing a few different tests. We'd also may want to investigate your partner if we're worried about a sexually transmitted infection, but that's less common. But the first thing your doctor will want to do is actually just visualize your cervix.
Okay, there's a question about tofu and whether it has increased estrogen due to the soybeans. I know there's a lot of concern about having too much soy with these kind of foods.
Yeah, people get worried about taking too much estrogen. Generally, it's not a bad thing if you are, because you're never going to have so much that it's going to have a huge effect, unless you're having loads of tofu for every meal. So tofu doesn't naturally increase your estrogen in your body because it contains a different type of estrogen. It's a phytoestrogen, which is a different type of estrogen that our body makes. Now it mimics estrogen. So what we find in like Japanese women who've had lots of soya, like lots of soya sauce throughout their entire life, they don't have like menopausal symptoms as severely because they've got a lot of sort of estrogen mimicking foods in their diet. We don't, I mean, unless you're having it for breakfast, lunch, and dinner every single day, 7 days a week, it shouldn't have that much of an effect. Generally, we say it's safe, and even if it does increase your estrogen, it's not going to cause anything too concerning like cancer. It's not really going to cause anything of too much concern, even if you do have it all the time.
Could I just follow that up with, is it safe for men to have tofu with estrogen?
Yeah. Obviously, in moderation. There isn't any strong link to say that it will start causing some estrogen-related signs, like they're not going to start developing breast tissue or start looking like a woman, unless you're having loads. But there hasn't really been any studies to suggest that, as far as I know.
Thanks, that's really reassuring. I know there's a lot of people worried about that. Okay, another question is, why is it difficult to lose weight when you have PCOS, and what can I do to improve this?
Yeah. Oh gosh, PCOS and weight loss is such a hard topic because PCOS is something, it's got a metabolic component. And what I mean by that is that it's related to other hormones in your body, like insulin. So like how many Asians are at high risk of diabetes and PCOS are linked. And it has an effect where it can increase the obesity around your tummy, your abdominal obesity, and so it means your body is just more prone to having more weight there, and means it's harder to lose it from that particular spot. So you might have really skinny arms, really skinny legs, but you just can't shift it from your tummy, and it's so typical because our bodies are just more genetically prone to be that way. In terms of what you can do about it, so the number one thing is swapping out carb for protein. So have more protein in your plate than carbohydrate, and have more fiber and more vegetables in your plate. In terms of exercise, I would usually, for PCOS, go for strength and resistance training way more than cardio. Cardio is good, so like running is good, cycling is good, but strength is much better because our body's metabolism works differently, and we are building muscle, which is better for our body composition and reduces that abdominal obesity that you get in PCOS.
And just to follow up with that, does that mean we can possibly reverse PCOS? Is that possible?
Yeah, you can. And I've seen in many women, we've scanned their womb, and we've seen lots of cysts on their ovaries. And then like 5 years later, they've changed, or we perhaps have put them on medication. We've rescanned them and the cysts have gone. So actually physically, we can't see it, and symptomatically, they're feeling much better. So you can technically reverse the symptoms with lifestyle.
Great. That's really interesting, actually. And so another question from the chat. Why do we have cramps before our period, and what can we do to reduce this?
Yeah. So cramps before periods, I think like 8 out of 10 women will have, typically before. That's in your luteal phase, and that's the phase where you've got high progesterone. So progesterone is good for you at some times, but sometimes it can lead to like breast tenderness, pain, craving food all the time. The other thing that you have that also increases with the progesterone is another chemical in your body, and it's called a prostaglandin. Your prostaglandins are these small chemicals, and they basically prepare the womb to release the blood. But the prostaglandins some people are a bit more sensitive to them, and we have a spike in prostaglandins, and that's what causes that cramping of the womb, which causes the pain. It's causing your womb to contract like a muscle. Like when you flex your arms, your muscles are contracting. Similarly, your womb is contracting to release the blood. So that is what's happening 1 or 2 days before your period or during your period, because your womb's like, we need to get rid of the blood. So that's why it happens. What can we do about it? Well, ibuprofen is really good because it blocks the prostaglandin, so reduces that cramping. Alongside the lifestyle and nutrition things that we already mentioned, there are some supplements that have got some evidence that they help. So one of the first things that a lot of women find helpful is magnesium. Magnesium is good for sleeping issues, but can also help with reducing cramping. With general PMS, so premenstrual syndrome symptoms, so the week before your period, calcium, so over-the-counter calcium, can also help with PMS symptoms. And they're the two main things from the top of my head that are quite helpful with cramping and PMS symptoms outside of having a good diet and outside of medication your doctor might give you. There are lots of other options that from a medical perspective that your doctor can offer you, but best to talk to them depending on your specific situation.
Thank you. And how do you feel about the pill for heavy periods to help with pain and the flow? And by the pill, I mean contraceptives or birth control pills.
Yes. So I personally think they're great. There is a lot of social media sort of myths and like scary stories about how it's affected many women. From my experience, I think when nothing else is helping, ibuprofen's not touching the pain, paracetamol's not touching the pain, you're doing everything you can in terms of nutrition and lifestyle. I think the contraceptive pill can really help to transform women's lives and allow them to have a normal life where they're not bleeding through their knickers and their underwear every day, and they can go to school and not feel embarrassed. The important thing to say about the contraceptive pill is it does stop your periods, but it doesn't affect your fertility. So as soon as you come off it, you can still get pregnant. And a lot of young girls and their mums always worry about that. You can still get pregnant, so I wouldn't worry too much about that. In polycystic ovarian syndrome, it's really good with controlling the acne around the face, the excessive hair, as well as periods. So I think it's great for that. There's a specific type of pill that we'd recommend if you've got PCOS. So overall, I'd say the risks, I think the benefits outweigh the risks. There are always risks with any tablet that you take, but generally, I think if it's affecting you to the point where you can't function, I think it's a very good option.
Thank you. That was helpful. I know there's a lot of anxiety around kind of pills and medications. So the next question is, does endometriosis go away after menopause?
Yes. So endometriosis is an estrogen-fueled disease. So when you go into menopause, what basically happens, for those of you that don't know, is your estrogen drops. And the reason it does that is because you've come to the end of your reproductive age. You can't get pregnant anymore. And so the estrogen drops, you don't have periods anymore. So if you don't have estrogen, you can get some symptoms, like you can get brain fog, you can get tiredness, you can get all the menopausal symptoms that you get. But endometriosis usually grows and gets worse with estrogen. And that's why sometimes we treat it with something to block the estrogen to stop it from growing. So when you get to menopause, you don't have that estrogen anymore. So your symptoms get better, and they generally it doesn't usually spread.
And does taking inositol help with symptoms of PCOS to regulate periods and help weight loss?
Yes, it does. There is a lot of research with myo-inositol. So I'd recommend myo-inositol. I talk a lot about supplements on my, I've had a lot of people have asked about supplements, myo-inositol for PCOS, that I talk about on Instagram. There's different types you can get, and you need to make sure you get the right ratio, because myo-inositol basically helps with PCOS and also your signaling of your insulin. And I mentioned that there's a link between PCOS and diabetes. So it can help regulate your hormones, and it can help to regulate your periods if you're not having regular periods. And it can also help with weight loss. So overall, it's a fairly safe supplement. You can't get this on the NHS because it's seen as like an over-the-counter supplement from Holland & Barrett or Amazon. And you can get it in different forms, like capsules or powders or, whatever. You can add it to your food, or you can take it as a tablet. But yeah, it's a fairly safe thing to take, and a lot of women find a lot of benefit from it.
The next question is about training. So how can overtraining or under recovery affect your cycle, fertility, or skin?
Yeah, good question. So when we are exercising a lot or putting our body through any excessive effort, our body and brain can't tell if we are in a life or death situation, whether we are running on the treadmill or whether we're running away from a lion. Our body can't tell. So what happens in our brain is our stress hormone goes up, our cortisol, which is our stress hormone, goes up, and the interference between our cortisol and our women's health hormones, our estrogen and progesterone, gets affected. High cortisol means lower estrogen and progesterone. So we produce less, so we don't ovulate. And what we find is if you're over exercising, you might actually miss your period. You might stop having periods. And it's really common. I see it in lots of marathon runners and people that exercise a lot. And that's because they are overstressing their body. Their body can't tell that they are putting, they can't tell that you're just exercising too much. It feels like it's too much stress. So if you exercise too much or even under exercise, then that cortisol level can interfere with your estrogen progesterone, and that means you're not going to ovulate, so you're not going to have regular periods. So it'll be harder to get pregnant. It doesn't mean you're infertile, but just harder to get pregnant. And you mentioned about skin. Well, any cortisol is a stress hormone, so you might have more breakouts because your body's thinking, oh, I need to stop replenishing the blood supply in my face. I need to focus on my the stress going on in my body, and so you'll have less skin regeneration. You'll get sort of more aging, more wrinkles. So yeah, so that's how doing too much of anything is not so good for you.
And can I just follow up on that? I know you said you've talked about kind of stressing the body physically. What about kind of mental health in terms of stress? How does that affect our cycles?
Yes, yeah. So mental health and cycles have a huge interplay hugely. So there is a mind-body sort of connection. And if we are stressed, if you're not sleeping, if you're constantly preoccupied, in just the same way as you're affecting your body, you will affect your mind with high cortisol, and that can throw off lots of different hormones, not just estrogen, progesterone. It can affect your thyroid. It can affect your diabetes level, and we know that the importance of stress management is really important in disease of the body because it can affect not only your women's health but also other organs of your body.
There's a question in the chat about nausea and whether that's normal on your first day of your period. And I know another symptom which can also be quite normal is diarrhea or bowel changes. Can you talk a bit about that?
Yeah, so nausea is really common, and it's to do with your prostaglandins that I mentioned, which are those small chemicals. Those prostaglandins don't only affect your womb, but they also affect your gut. So basically your digestive system to work more actively, and that then causes your food to come up because you're not digesting it properly. Similarly, with your bowel movement, your womb is contracting really hard to get this blood out, and your womb and your bowel are really close together. The organs are literally right next to each other, so those chemicals also affect your bowels, and that's why a lot of women get diarrhea or get really loose stools during the time of your period, because everything is contracting to get the blood out. So similarly, it tries really hard to get the stool out. So you might get bloating, you might get more gas, you might feel more diarrhea. Some people even get more constipation, and it's generally because of that effect of the prostaglandin at the beginning of your cycle. That's why it's important to take things like anti-inflammatory foods, so like haldi, turmeric, ginger, berries, having like magnesium is really good at that time because it reduces that prostaglandin.
Okay, and we're running out of time now, so I'll just go to the last question. Going to make it a double one, but there's someone who said, my 13-year-old daughter gets severe pain on day 1 of her period and needs adult dose paracetamol to get her through. Is this normal? And also, girls are now starting to have kind of periods earlier. Is there a reason for this? Why is that happening?
That's a good question and a big topic, but let's talk about it simply. So the earliest I usually see periods is around age 8 or 9. If they're younger than that and they're getting periods, we need to do some more tests. So some more blood tests looking at their hormone levels and maybe refer them on to a hormone doctor. Age 13, it sounds like a fine age, but we are, from what I've seen, I haven't looked at all the papers on this, but I think we are seeing children starting their periods earlier and not following sort of what their mother's age of first period was. And I think there's a few reasons. I think there's a lot of lifestyle factors that are changing. There's more junk food, there's more natural estrogens in our everyday lifestyle, there's more toxic ingredients, there's more microplastics in our food, and there's more and more evidence coming out about how it's affecting our hormonal health and how it's allowing girls to have periods earlier. So I think lifestyle, food, and just having not as healthy lifestyle as perhaps our ancestors were 30, 40 years ago. That's the first thing. The second question was sorry, what was the second question?
Sorry, it was 13-year-old daughter gets severe pain on day 1, so she's needing adult dose of paracetamol. Okay. Is that normal?
Yeah, it's hard to say. We know that period symptoms will change up until 7 years after the first period. So if your first period is age 13, we expect right around sort of age 19 for things to all settle down. You'll have regular periods, the symptoms will settle down. There's a lot of irregularity whilst the hormones are fluctuating during that puberty time. Now, if it's so heavy or very painful, then we need to consider whether there is anything else going on. Even if we were worried about, say, endometriosis, for example, I'm not saying that's the case, we then need to question, what will we do in a 13-year-old? Are we going to put a 13-year-old in surgery to investigate it? Perhaps not. Maybe we just wait a few years and see how it changes during this, this fluctuating time, to see if we need to subject her to any risk like that. Perhaps we treat her with contraception or pain relief and see how it plays out before we rush to something too invasive, and we try all the lifestyle things first. So I wouldn't panic straight away. I'd watch and see how this goes. If it's affecting her so much that she can't go to school, then I think we need to, you probably need a few more investigations.
I think we're going to have to wrap up there. There's lots of questions that we haven't answered, but I don't think we were going to get through all of them anytime soon. So apologies for that. There are some perimenopause and menopause related questions, but we are having a webinar later in the year, probably around October time, for menopause specifically. So I hope that's been helpful. Dr. Ravina, thank you so much for your time.
Thank you.
Dr. Ravina and I actually went to university together, and so it's been wonderful to work on this together. And we look forward to inviting you to the temple sometime soon.
Thank you so much for having me, and well done for this great initiative. I know there's loads of questions. I'm happy for people to message me on Instagram for anything general, and happy to do women's health educational videos for you. But yeah, thank you so much for having me, and I hope you found it useful.
Yeah, thank you. Just an announcement. We're going to take a break from webinars for a couple of months, but we'll be resuming in September. And as always, we need to mention the book. So we've released a new vegan and vegetarian recipe book as part of the BAPS Wellness Initiative. The book is a collaboration from doctors, nutritionists, and our satsangis to create tasty, healthier dishes for people to continue to enjoy the foods that you love, but in a healthier way, and in a way that also supports your hormonal health. And that's available in bookstores.
Thank you. Thanks everyone for joining, and thank you, Dr. Ravina, again. Jai Swaminarayan. We look forward to seeing you at the next one.
Thank you.
Thank you.
Bye.
Yes, ma'am. Bye.
Yes, ma'am.